for taking the time to speak with us during this Star City Stories. This is September, and we want to educate people. September is National Suicide Prevention and Awareness Month. What do you want folks to kind of keep in mind during this month? And actually, 365 a year.
Yeah. So I think what is a really important conversation to have about suicide and suicide prevention awareness is more than 720,000 people die by suicide every year. And it's the third leading cause of death among 15 to 29-year-olds. And it's not a mental health emergency, right? It's a public health emergency. Yeah. So I think that's the lens that we need to respond to the situation through. We need to mount a public health campaign around suicide prevention awareness.
Yeah, I mean, we really need to have consistent compassion and empathy. And it's interesting you said you talked about mental health, because certainly over the past few years, leading into the pandemic, during pandemic, and post-pandemic, we were, mental health has kind of been at the forefront, talking about people and making them realize that it's okay to say that you're not okay. How
Absolutely.
important is it to where are we in that whole message of kind of stopping that stigma and getting people to access help and resources and kind of admit that they're going through stuff?
Yeah, I think that's still a work in progress, right? That's the public health campaign behind it all. It takes a lot to undo decades of ingrained human behavior, and that's what we're asking people to do. We're asking people to accept that it's okay not to be okay, and that we can reach out to help. And we're asking them to do that in a time where it still feels really uncertain if that's true. Right? It still feels uncertain around even if I do reach out, do I have access to resources that are going to be able to help me? Can I get them timely? Can I get them how I want to get them in regards to, can somebody come see me face to face, or do I have to sit on a wait list for long periods of time? Right? So I think that's all part of the conversation that we have to have, and working with our communities around what suicide prevention and intervention looks like.
How can I guess communities be supportive? When I also think about like workplaces and organizations, if you need like a mental health day to kind of do that, how can we kind of, and I've actually asked this question when we talk about substance use prevention and substance use disorder. How do we get workplaces and companies to support if you need to kind of take time to kind of do you and get yourself back together? That makes you a more successful employee, a more valuable employee, and a productive employee.
Absolutely. So I think, right, that's all part of the conversation that each employer needs to have. Do they have a good, easy to follow EAP process? Do they have connections with local behavioral health organizations to facilitate connection to resources for their staff promptly and timely? The World Health Organization talks about the fundamental pillars of suicide prevention awareness, which is situational analysis, what's going on in your workplace, in your community, multi-sectoral collaboration, awareness raising, capacity building, we need to finance it, and surveillance and monitoring after all of that implementation is done. Is what we did working? And if it's not, what needs to change?
What are we seeing as far as stats, as far as people who are attempting to take their own lives, or who have? Is it men versus women? Is it young versus old? Ethnicity groups and things like that? What's your take?
Sure. So in the United States, certainly we see individuals who try to take their own life in those marginalized groups, LGBTQ, individuals of color. We do see individuals who are very young attempting suicide earlier and earlier, and of course individuals who are older. And looking at the leading causes of suicide, or the risk factors, I should say, around suicide, right? Those demographics shouldn't shock anybody, right? When you have feelings of emptiness or hopelessness, when you're trapped or you can't find a reason to live, when you're extremely sad or more anxious or agitated, when you have unbearable emotional or physical pain, right? So we see all of those things represented in those high-risk demographics.
So what are you mentioned about some of the signs? What about, considering where we live? It's fall now, but we're going to eventually get into the winter months. It's inevitable. And being in a place like Maine where it is winter for most of the part of the year and we're kind of hibernating and we're isolating, does that kind of play a role for people in their mental health?
Absolutely, it does, right? Lack of sunlight, vitamin D, and then lots of our counties in Maine are so rural, right? Um, and not just rural, they're remote. So they're rural and remote. um, and that creates access barriers. It creates social isolation, which we know is a leading cause of increased thoughts of wanting to harm yourself and suicide attempts. It creates a whole host of other challenges and barriers with the rural remoteness of our state. And we're an aging state. Maine has one of the oldest, I think, if not the oldest, age for its community members in the continental United States.
What do you want? Let's talk. What are the resources available? We know about 988. For those who may not know, what exactly is that, and what other resources in our local community can people access if they're challenged with something or they know someone who is going through a challenge?
Sure. So absolutely 988. So Maine stood up 988 2 years ago now. Yes, we just passed our 2-year anniversary. So 988 is phone calls are answered by the Opportunity Alliance in South Portland. They're also the individuals, if you call the Maine crisis line, that 1-888-568-1112 number. Opportunity Alliance in South Portland also answers that. They are the primary call center for the state of Maine's mobile crisis, telephonic crisis response. So when you talk to the individuals on the 988 line or that are covering the Maine crisis line, they will perform a telephonic triage screening tool and work to try and de-escalate and to problem solve the situation right on the phone. If that's not appropriate for the situation or if that's not doable, then they will pass the phone call to the area where you're calling from's mobile crisis response team. Yeah. So there are 5 contracted mobile crisis providers in the state of Maine. AMHC covers the Aroostook, Washington, and Hancock counties for mobile crisis response. So if you live in one of those 3 counties, we would receive the call from the Maine crisis line or the 988 operator, and we would work to send a mobile crisis response either to you in person, or if you chose to do it telehealth instead, then we could provide a telehealth response as well, whatever the client is comfortable with.
Wrapping this up, what's the final message that you want, the takeaway for folks if you're going through something or you know someone who is going through something?
Reach out. Please call. We are always happy to take your call, and we are always happy to work alongside you and support you through whatever crisis has led you to feelings of wanting to end your life or not wanting to be here anymore. And call early, right? Call when you're starting to struggle. Don't struggle in silence.
Thank you so much for taking the time to speak with us for the Star City Stories. And we want to thank you and all of the volunteers and everyone at AMHC for what you do every single day. You guys are heroes in helping people walk toward and find the light and recognize that no matter what you're going through, it's temporary, but being here and taking that first step is the important and critical part to seeing the other side of that, which is hopefully happiness. Thank you.
Thank you.